number 7, which is about evaluation. Now you've been around this whole cycle from clearly defining a question and searching for the information, critically appraising the kinds of evidence that you get, synthesizing diverse evidence in a way, adapting it to the local situation and making a decision, including all of those factors that come into decision making from the perspectives of population and your financiers about implementing or stopping a program implementation. If it's a decision to implement it or stop, you still have to have a plan for how to implement that decision. And now we're at this stage of evaluating that decision. So there are 2 primary issues to think about. What are the outcomes that you need to think about that would be indicators for whether or not this intervention has been effective? And you need to think about, before you actually implement a decision, to collect some baseline information. We've lost so many opportunities in public health situations where we've implemented a program and haven't thought carefully enough about the indicators or the outcome indicators until a couple of years later, and we've lost the ability to gather that baseline information to see if there's been any change. So there's really a need to focus on 2 different types of outcome indicators. First of all, the behavior for healthcare professionals. Can you assess whether or not the people who are working in the intervention are actually being true to the intervention as it was being developed? Are they taking shortcuts? Are they making it less intensive? Are they not comfortable doing parts of the intervention, and so they're leaving that out or not doing it to the level of expectation? So there's a term sometimes used for that called fidelity. So is the intervention being delivered the way it was developed to be delivered, or has it been watered down because of the lack of resources? So evaluating whether or not the healthcare practitioner's behavior has changed, and if it's if they're really being true to the intervention. And finally, why we're doing all of this is to get population outcomes. What indicators are there that you could say a few years from now that it's made a difference for the population in your region? So sometimes it's easier to collect population level data. There may be mechanisms for looking at that as a baseline and as outcome indicators a few years after an intervention. Sometimes that kind of information, depending on the program you're putting into place, is impossible to get, and it's easier to measure healthcare behaviors as a proxy. It's not a very good proxy, but if you don't have some idea of behavior change and there's no change in the population in a few years, how do you know that there's no change because the intervention isn't working, or there's no change because in fact the providers have not been providing the intervention in the way it was designed? So again, on our Register of Methods and Tools, there are a number of different tools you could find that will help you with evaluation of program decisions, programs that have been put in place, how to plan for that evaluation and how to conduct that evaluation. So I'm hoping you'll have a look further at our website, which is nccmt.ca, and explore those kinds of tools on the registry. So this is the final webcast, and we've now been through the entire circle. And if you want to get any more information about the entire process, there's an online module that is called Evidence-Informed Decision Making. It explains the whole process. It's a self-paced module that takes somewhere around 5 or 6 hours for you to go through as an individual. We know that groups are working through that online module together to help their learning and to discuss some of the situations. There are also modules about the critical appraisal piece for actual intervention studies, individual studies, and there's a module about systematic reviews. So there are lots of other ways to increase your depth of knowledge about these interventions. Thank you.